welcome back to the Morning Blend. The holidays are a great time for families to celebrate, give thanks, and reflect. And with everyone together, it's also the perfect opportunity to talk about each other's health.
That's right. Here to show us how to get the conversation started and the importance of advanced directives, which we're going to explain, is HealthCare Partners clinical educator Ellen Aliberti. Hello, Ellen. How are you?
Hi,
good morning.
Good morning. Happy Thanksgiving.
Happy Thanksgiving to you as well.
Thank you.
We hear people discussing family health history with relatives during the holidays. Why is it so important to be talking about this?
Well, first of all, it's important because, you know, you're really only talking about these issues with your immediate family, but the holidays gives you an opportunity to have extended family be there, and this information can be vitally important when you share it with your primary care provider, and they can help, you know, abort any diseases or conditions that you might, you know, be at risk for based on your family history. So it's a great thing.
And why not do it? Because the family is together. Sometimes they're in a different state, and so when they're all together, everybody's on the same page. Knock it out.
Knock it out is right. And you know, it's a particularly important time for seniors too, in terms of talking about their advanced illness or as they begin to prepare for their end of life. And you know, I know it's a scary conversation to have, but the holidays gives you a great time to do it, because I like to frame it in terms of a gift that you give yourself, and what better time to give it to yourself and your family but at the holidays.
Yeah.
So what is an advanced directive?
Well, an advance directive in its purest sense is a document that you fill out to make decisions about who's going to make decisions for you in the event you can't make your own decisions. You assign somebody and what you want to have happen. So that's the purest sense what an advance directive is, but HealthCare Partners is taking it a step further by assigning the 5 wishes advance directives, the one that we use with our patients.
So those 5 wishes would include what, so we can start thinking about it?
So the 5 wishes, and I have the document here, the 5 wishes, of course it wants you to identify who's going to make your decisions, what kind of medical decisions you want, but it takes it many steps further to talk about how comfortable do you want to be, what kind of things do you want your family to know about you, and also how do you want people to treat you if you're at your end of life, which is a really beautiful thing to think about.
Because if you don't, then what happens when it comes to this situation?
Exactly, and you know, so many patients or people out there know somebody in their family, their neighbor, or their loved one who has really suffered unnecessarily at the end of life because they had nothing in place. I say, take control of your life. Make this a gift for yourself and your families.
No question.
Please.
I've had this happen in my family before, where, you know, there's a member of my family who's at their end of life, and the family is deciding what happens with this person. There's no clear directive. We're all trying to guess what they would want, and it doesn't necessarily end well.
Right, and I want to say one more thing about the 5 wishes, because you know I'm passionate about it. HealthCare Partners, you can get these at all of our clinics, both of our medical group and our affiliates, but also, just know that the 5 wishes was created in conjunction with Mother Teresa and all the work that she did with people around death and dying, which was made things very beautiful. So don't be afraid. Jump on in and talk about it with your families.
How do we ease into this topic?
You know, every family dynamic is different, but I would find somebody in the family that supports your wishes. Maybe a medical person. My family's in luck. I'm a nurse. But somebody who, you know, supports your wishes, who's experienced it with a friend or a family member, they're going to support you and understand how important it is to make your decisions, whatever they are, and then for people to respect it. It's a great gift for yourself. It's a great gift for your family. Let's do it this holiday.
Yeah, and HealthCare Partners has things that you are doing for seniors and different programs. Can you talk about that a little bit?
I can. You know, HealthCare Partners, we embrace the total care model, which looks at the senior from all aspects, whether they need help with transportation, helping establish meals, comprehensive care, 1,000 specialists available to them. Care coordination, great program for older adults.
No question, and it's open enrollment right now, so people, seniors need to get on the ball.
They need to get going because the open enrollment is still on, but it's going to be ending on December 7th, so get out there, learn about your choices. Healthcare delivery is changing as we speak. Let's get our seniors informed to make good decisions.
Yeah.
Ellen, happy Thanksgiving.
Happy Thanksgiving
happy
to you.
Thanksgiving
Thank you
to you.
so much for having me.
We love having
Thank
you.
you.
On. HealthCare Partners Medical Group, they're hosting a HealthCare Q&A as part of open enrollment. One is next Tuesday starting at 2:30 p.m. Another one Wednesday the 28th, which is also a bocce ball tournament. Love it, starting at 4 p.m. More information right there on your screen.
She'll be there. If you have any questions, go to keepmydoctornv.com. You'll also find a list of upcoming events on that website as well. Still